Ohio now ranks third in the nation for the number of children between newborn to 6 years old that don't have access to health insurance.
News 5's Mike Brookbank here now with what's being done locally to try to break down those barriers to health care.
Yeah, Robin and Danita, in Cuyahoga County, there's an estimated 2,300 uninsured babies, toddlers, and preschoolers. As for why there are so many, I found out today a lot of it comes down to a lack of education.
Definitely worked in situations where people were turned away.
Pediatrician Deborah Friedman.
It makes you feel a little bit helpless.
Reacting to new findings by Georgetown University that show a 40% spike in the number of uninsured babies, toddlers, and preschoolers in our state.
That's a sad statistic for Ohio.
Nearly 42,000 children ages newborn to 6 facing uncertain futures.
During that time, children are growing and developing very quickly.
Both physically and emotionally.
Especially in the first 2,000 days, as we call it, before a child enters kindergarten, 90% of their brain is formed.
As for why we're seeing this trend,
the big piece is educating families.
Carol Beatty with the Centers in Cleveland tells me parents without access to insurance are often confused.
The marketplace, as we know, sometimes navigating that can be confusing, which is why we want them to be able to get that support and that person to help walk them through.
The Centers mobilizing a dedicated team to get children insured.
Part of it is getting that message out to see what families do qualify for.
Many of them may be working.
They may make just a little bit more than what's needed to qualify for Medicaid.
But either their employer doesn't offer insurance or it's too expensive.
We definitely can do something about it.
Without regular access to health care during those crucial years,
it's just really sad. It's really sad.
There's growing concern some children are falling through the cracks.
There are a lot of vaccines and they're exceedingly expensive to get. So health insurance and coverage is really important at that time to get the vaccinations they need for a healthy future.
These recent findings getting the attention of Ohio Governor Mike DeWine. This week he issued a directive to the state's Medicaid office to look into ways to make it easier for families to get insured. Again, Robin, Danita, this trend deeply disturbing for child advocates because we know about the brain development and how quickly that happens in children in this age range.
Wow. All right. Let's see if we can turn this around. Thank you, Mike.